Giwa is our next speaker, and he's a man of many hats, including a physician scientist, medical director, mentor, and philanthropist. He began his academic journey at the University of Notre Dame, where he majored in pre-med and Spanish. He went on to earn his medical degree from the University of Pittsburgh School of Medicine, where he completed his pediatrics residency at the University of Chicago Comer Children's Hospital, and later specialized in pediatric endocrinology at Johns Hopkins Children's Center. As a physician scientist at Johns Hopkins, Dr. Giwa's research team is most recognized for the discovery of a novel lymphocyte linked to type 1 diabetes, a paradigm-shifting breakthrough in the field. In addition to his research, he serves as a medical director, overseeing international clinical trials for patients with rare endocrine diseases. Dr. Giwa has been deeply involved with the Association of Nigerian Physicians in the Americas, or AMPA, for over a decade. As a young physician, he served as the membership chair and DNPT AMPA liaison for the Distinguished Nigerian Physicians of Tomorrow. Today, he continues to serve as chair of the Diaspora Graduate Group, a member of the investment group, and an executive member of AMPA's Education Committee, where he leads the highly impactful residency workshop series that helps hundreds of young doctors match successfully annually. His passion for service extends beyond medicine. He serves on the board of trustees for the Loyola School in Baltimore, supporting early education access for low-income families. He is also the founder and president of Thy Gifted Neighbor, which is a nonprofit organization dedicated to mentoring and uplifting students interested in STEM and medicine. Outside of work, Dr. Giwa enjoys cooking, gardening, martial arts, and anime. So please join me, everyone, in welcoming Dr. Adebola Giwa. And we're so thankful and grateful that you are here today. So take it away.
Hi, everybody. How are you all doing? And thank you, Priscilla, for that introduction. As you said, I'm Dr. Debula Giwa. Thank you all for coming out this Saturday afternoon or morning, depending on where you are. Just to make this a little bit more interactive and I have a better idea of who's here on the call. Sharing my screen. Yes. So put in the chat. One, if you're a pre-med student. Two, if you're a medical student, and three, if you've finished medical school already, whether it be in US or Nigeria or otherwise. Okay. So I see we got a mixed bag. So welcome, no matter where you're dialing in from. Okay. So the next interactive question I have, this whole thing is about networking, right? So where is the most common place that people network? Usually at conferences. So how many of you here have been to a conference and have gone to the exhibition hall? That's where all the vendors and programs and everybody trying to sell you something are. Put a one if you have been to an exhibition hall, and put a two if you have not. Okay, I see again another mixed bag. So next we'll go on to the first scenario. And for those of you who haven't been to an exhibition hall, just to give you an example, if you've gone to an AMPA conference or if you're a member of SNMA, the Student National Medical Association, you go to a conference and there's a whole agenda of different talks you can go to. Generally, these talks are in different rooms. You go in, someone gives a talk and presentation, etc. And then there's a big giant hall. And looking at the background, there'll be different booths in the hall. You can kind of think of it as this place as an exhibition hall. And each table, maybe there's somebody trying to sell a product or a program trying to sell their program. And this is the exhibition halls. The main purpose of it actually is for networking. So over here we have our first scenario. So I will pretend to be the person who's representing a program. I'll be this guy over here, just kind of different glasses. a lot more. He's a little less charming than I am. We'll just pretend. Now I want you guys to think. I'm going to give you three types of students. Student one, student two, and student three. And as I go through this, um, I want you to think which one of these students have you been, are you usually when you go to these kind of conferences? Okay. So I'm the uh the person at the exhibition hall. Okay, so I have three medical students come and approach my booth. Usually you guys would travel in packs because it's a lot less intimidating to go talk to somebody one-on-one when you have your friends with you. So I come in, I introduce myself, I encourage you to sign up, and I start telling you about the program. Student one, he listens, he kind of starts to look away, he writes his name down on the sign-up sheet, he takes some candy, and then he dips out. There's always that person for sure at every conference. Not really interested in networking, just kind of wants the free candy on the table, maybe takes a brochure to be polite, and then kind of moseys away. So now there's two students left. They both listen to what the person says. They write their name down on the list, and now we'll go to student two. Um, she also takes some candy. He notices he has a cool elephant necklace. Comments on the necklace, smiles at the end of the talk, shakes hands, and goes their separate way. And then number three, the, similarly, he listens, writes his name down, asks some good questions. He's interested in this program. Then at the end of it, he asks for the person's business card. So he gives him his business card. He actually has his own business card, and he gives it to, um, we'll just call him program director, so I don't have to keep saying me and him and she. Gives him the business card, and then he comments that, hey, look, your name, you have an interesting name. Is this Adebola, Adebola? How do you pronounce it? He's like, well, actually, I have it phonetically on my card. They kind of joke around because they're both Nigerian and they every day have to work with people who can't pronounce their names. And um, then they go their separate ways. A week later, the program director sends an email to everybody that signed up, and he sends a follow-up email. Okay, so tell me now, be honest. I don't know any of your names, and I won't memorize who said what. So you should memorize all the information that she gave about me and my intro, because you'll be quizzed on that. Just kidding. But yes, which one of these students do you resonate with the most? Student one, student two, or student three? Okay, so we see a lot of twos and threes. That's great. That's great. I remember back when I was a medical student, for a large part, I was student one. But kind of as Priscilla said, it's about depth. So I was student one most of the time, but every once in a while, I would be student three. Now, let me tell you what happens with student three. So the program director sends him an email and he responds back. In the email, he says, hey, thanks for giving me more information about your program. I really enjoyed the talk we had. And then he actually says in it, hi, this is, puts as a little joke, phonetically spells his name there. This is that. We met at this and that. I'm so glad that you followed up with me. Thank you for giving me more interest. Thank you for giving me more information about the program. I am really interested in your program. And then he lists specific things about the program. You have this, and that. Um, so the SNMA conference actually happens every year at Easter time, which is actually this weekend. I think it's in Missouri. So it's April that he's doing this. He sends it, hey, I really like your program so much. I will likely be applying sometime once the application season comes up. Um, and then he says, hey, maybe you could give me more information about this and that specific program. The program director responds to, hey, that's great. Here's more information about that specific program. And then a few months go by, and now it's maybe August, maybe September, and now it's time to put in applications. ERAS season happened, puts in the application. Now it's October. Now student number three goes back to that same thread and says, hey, thanks so much about giving me more information about your program. As I mentioned before, I'm really interested, and the information you gave me made me even more interested. And I found this and that about your program. I think I'd be a great fit. Maybe throw in a couple of things about yourself and just say, I actually submitted my application later. Hopefully, I have the opportunity to find out more about your program in real life if I'm given the opportunity to interview. Wish you all the best. And bada bing, bada boom. 2 weeks later, he gets an interview invite. And that is the story about how I got into my residency program. So, to a certain extent, as Priscilla said before, it's not always about what you know, it's who you know and who knows you. One of the things that was not included in my intro, and I wanted to tell you guys now, is that I've actually been on the selection committee for my medical school, my residency, fellowship, and later on. And I tell you, when all the ERAS applications come in, we get a stack. Well, it's not an actual physical stack anymore; it's a virtual stack. So now it's just like a screen with a long list of people. There's a lot of very competitive people, and when it's time to pick who do you interview, who do you not interview, with everybody being so competitive, and sometimes it's hard to differentiate one from another. Sometimes just being able to put um, a face to an application outside of the picture can really help set you apart, especially when two things are so similar. And as was mentioned before, the people who you network with are going to be your advocates. Now, the example I gave, there was only about two or three interactions. There was one interaction here, and then there was a follow-up email. But that was enough sometimes to even get you that far. So, as Priscilla said, you don't necessarily have to be besties or anything like that, but just having that can be enough. And even if you were this guy or that guy or this woman, if you had done the follow-up steps, you could have been just as competitive and got an interview just like him. Because just as Priscilla mentioned, you know, these days you're going to meet a lot of people, and they maybe all have very similar names and maybe they don't, so it's hard to really put a name, a face to a name. So even if this guy had emailed me with this same content, even though he only took candy and left, he would have had the same chances. So what that leads you, what I'm trying to tell you, is that some of the good things to that really help you stick out. One, if you can make a connection with that person, something that makes you stick out. So that can either be something personal about yourself or just something in your conversation. So, the phonetic spellings of their names was a little small conversation um, nugget that was there that they can then reference in the email. So that way, like, oh, you know what? I do remember having that conversation, as opposed to maybe somebody who went and just asked a generic question. This woman could have also done the same thing and talked about the elephant necklaces. Or this guy could have even said, you had some really great candy on your table. So that's just an example of how networking can really help you and help you become person number three. And that's what I'm going to be talking about during this presentation. We have a limited amount of time. So what I'm going to do is I'm going to go over why networking is important, give you there's many different scenarios and opportunities in which a person can network, but I'm going to give you three very common situations where you can network and how to do it well. I just finished scenario one, so there's two more coming up. And then after that, I'm going to give you some specific pointers, some pro tips about what you can do while you're networking to make you look like a star. Okay. Why is networking important? For this, as well as medicine, we know evidence-based is what we do. So all you really need to do is check the scoreboard. Here are some key stats about networking and job opportunities. 70% of jobs are never published publicly. This was in the Forbes magazine. A lot of jobs are actually filled through networking and internal referrals. So how that sometimes works out, especially being where I am post training, sometimes there's a company, a hospital, etc., that has a position that needs to be filled. And before they even put a post out on LinkedIn or in the classifieds, they'll talk within their group, hey, we need to have this nurse position filled, maybe. Do any of you know any good nurses? And then that's sometimes how it'll get filled before it even gets published. Because if nobody knows anybody internally, then that's when they'll go look outwards. Because I'll tell you, being the hiring manager, it can be very daunting. I was talking to one of them at one of my previous companies, and he was like, "Man, I put a post out for this position, and I had around 75 people apply within a week." And half of them are not qualified. The job clearly states we need an MD, and some of these people just have a bachelor's degree. And with you being a hiring manager and having a busy schedule, it takes a lot of time. You don't have a whole lot of time to sift through all of it. So then sometimes they'll hire hunters to then go sift through it. But if you already know somebody, you don't even have to go through that. So that's one of the reasons why networking is important, knowing somebody on the inside. 85% of jobs are filled through networking. Again, that's kind of what I said. Referrals are 4 times more likely to be hired. Again, as Priscilla was saying, people advocating for you can really give you a boost. Employee referrals account for only 7% of applicants, but 40% of hires. Um, Yes, that's definitely true. And, I was looking at a recent stat. I'm also in the biopharma space, and especially with all the tariffs, you guys know a lot of jobs, a lot of people have been laid off. And I actually had a past coworker of mine, she was laid off, and I was talking to her, and she was saying, "Man, Adable, it's really rough out here. Um, I've been looking for a job for the last 5 months, and I haven't been able to find one. I've had to dip into my 401k." And I was helping her through that. And I was like, "Oh, I'm sorry. I'm sure something will come up. I'll let you know if I know any opportunities." And then I was starting to send her some things that I had heard of. And then the previous week, she said, "Hey, Dave, look, guess what? I just got a job." And I was like, "What? Where'd you get a job?" And it was at actually one of the biggest biopharma companies in the country. And I said, "Oh, how did you get into that position?" I think I saw it on LinkedIn. There was like more than 100 people that applied. And she said a previous coworker of both of ours had given her a referral. And then within 2 weeks, she went through the interview process, and she just had her first day last Friday. So that just goes to show you how far these referrals can get you. Networking can lead to 60 to 80% of job opportunities. That's definitely true. And how that kind of plays out is a lot of times when people are looking, um, just all the people that you know will help you with regards to the referrals, know about what is available, and they'll help you get the job opportunities. Informational interviews lead to 1 in 12 job referrals. So that's a bit of a underrated um, tactic. How this played out for me, actually, happened to me in medical school. I was on the national committee for SNMA. I was a national parliamentarian, and we were going to have a regional conference in Boston. And one of the places that was sponsoring the conference was actually Harvard. So Harvard had actually sent an email to everybody on the executive committee just saying, hey, thanks for coming out. Feel free to reach out if you need anything. And it was somebody in pediatrics. So then I actually emailed them back and I said, hey, that's really great. I'm actually applying for your PEDS program, blah, blah, blah. And I said, I'm going to be in the area. I was interested in actually applying to your program. Do you think it'd be okay if I stop by? And they said, yeah, sure. We're actually having um, this we're actually having a special program right now. Feel free to stop by and I'd be happy to talk to you. So I actually got I went on a basically an informational interview at that time at Harvard, and that helped me get an interview later on during the application process. So that's just one way you can get in because I mean when I was in the med student time and place, my grades were okay. Was it necessarily Harvard level? Just looking at it, just that's debatable. Though the rest part of my application, had its highs and had its highlights, but this was definitely something that, if I'm being honest, not completely sure I'd necessarily get a Harvard interview right off the bat. So that's just one way you can do it. Okay. Why does networking actually matter to you as a medical student? Some of you may say, like, well, that's nice if you look for your jobs on LinkedIn, but I'm applying through this and that. I don't know if this is really germane for my specialty. And as was mentioned, a lot more physicians have social media and LinkedIn nowadays, but some physicians still don't think that they need it, but there's definitely been a big rise to it. So, does anybody recognize what this is? If you do, can you tell me what uh this caption is showing? Okay. Well, maybe you do, maybe you don't. So what this is a Pop the Balloon. It's this new show that's on Netflix actually. And this was a recent episode that just came out. And this is basically what happens is a person comes out and they talk to it's a dating match show. And either a guy or a girl comes out and there's 10 or so people of the opposite sex and they ask each other different questions and if they don't like the person for whatever reason, it could just be oh, I saw you for 1 second and I don't like your shoes. You pop your balloon if you're interested, and then you you keep going until somebody has a balloon left. So I put this one here because I thought it was interesting. You know, very attractive people on both ends, very competitive. But right when she came out, she saw this person and they're like, what? Cinco? This is Zaina, this is Cinco. She's like, Cinco, what are you doing here? She's like, I didn't, whoa. So it turns out these two actually just met each other the previous weekend. Apparently they're at Coachella together. And then right when they saw that connection, three other people popped their balloons and just like, hey man, they already know each other. I don't think I have a chance. This is not going to work out. And then they went on to ask each other questions, and lo and behold, they wound up choosing each other and are dating. So that just goes to show you, you're like, so what does that have to do now? You may be able to guess, even though these people apparently only knew each other very briefly, and there was a lot of other competition. Just having that brief interaction was able to get this person through um, and get the prize at the end. So what does that have to do with you guys? As you see here, maybe you were reading this already, residencies. Knowing someone in a program could help students get interviews and second looks. I gave the example about my residency program as well as interviewing at Harvard. Research opportunities. Many projects are offered through word of mouth or prior working relationships. As was mentioned, I've did a lot of research at Hopkins, and every once in a while, if you want to, it's hard to get into research to find research opportunities, especially if it's not at your own institution. So every once in a while, people will shoot their shot, as Priscilla was saying. And I'll get an email from a complete stranger and they'll say, "Hey, hi, I saw that your research in this. I'm from here and here. Could I be involved in your research?" And I get those all the time, but we definitely in our lab, it's pretty selective. We're definitely more likely to take people who are in Hopkins and have that connection compared to a complete stranger from someplace else. But that doesn't mean you shouldn't shoot your shot. Some of the people who did do the email well really show that they had a connection, really show their interest, really show their qualifications. We brought them in for an interview. So if you're interested in research and don't know how, one thing you should do is look for programs near you. If you're on the other side of the country and hey, can I do some research with you remotely? You're less likely to get it versus somebody who's nearby and someone at your own institution. As I mentioned, the benefits of that. Then what you should do is, as we said before, do your research, look up what things have been published, and then make a connection in the email. Give your brief elevator pitch in your email discussing your qualifications, your interest in the research topic, your availability, and ask for the opportunity to potentially interview and join the team. Mentorship, access to guidance. So if you network with the right people, you can find a mentor. And mentorship is really important. As was mentioned, I just started a nonprofit organization doing mentorship. I've been doing mentorship in some shape or fashion with different organizations for over the last decade. I've been able to help hundreds of kids and students, help them through residency. And every year I probably take on about a dozen mentees and I kind of mentor them personally. And my matriculation rate is like somewhere higher than 95%. So all my mentees, because of the knowledge I have being on the selection committee, I kind of go through their applications, their personal statements, coach them through interviewing. About 95% of them have gone on to residency in the previous cycle, regardless of what their success rate was, multiple attempts and tests and ERAS applications, um, because I kind of know what are the things to look for and how to show them in the proper light to make sure that they get through. So that's something that a mentor can help you with. Specialty choice. So a lot of people have a lot of interest in different specialties. So if you want somebody to mentor you um, in a particular specialty, that's really helpful because they can help you write a letter of recommendation. And with this, I want to say that when it comes to picking out a mentor, it's important to realize that you can't really have one mentor that just teaches you everything. Different strokes for different folks. And with that, the most successful people will tell you that they've had a variety of mentors. If you're interested in different specialties, if you're interested in developing different parts of your overall person, having different mentors will help. So maybe you have somebody that you go to if you want to talk about finance. Maybe you have somebody to go to if you want to just talk about psychiatry. Maybe you're interested in psychiatry and surgery. So you'll have a different mentor for that, a different mentor for this. Maybe somebody who's just academics, if you want somebody to tell you how to get through a rotation, and then you have a different mentor to tell you how to get to research. So with that, I'm saying try to find mentors that will be good for each realm and don't necessarily try to find one person that can do it all. And when it comes to networking, sometimes you'd be surprised who are the people that can help you, even though they may not seem to be it based off of their business card. So just for an example, one of my mentees is interested in urology, and I'm a pediatric endocrinologist. At first glance, if you were to walk into a conference and look at people's name tag and see Pete Endo, you're like, well, I'm not interested in that. But what he doesn't know is that in my network, I actually know uh, West African urologists. So I said, hey, man, if you want to know more about this specialty and what are the best ways to get there, I can just connect you with my friend. So those is one of the hidden opportunities. And then also, um, we also talked about in the previous just hidden opportunities just from networking. So just as an example, my niece is applying to college. And when she was applying to college, there was a lot of things she didn't know. So I was able to tell her, hey, back in my day, this is what we did, this and that. And given where I am now, I know you can find scholarships from here, here, here. Here are good places to look, and here are good methods to get there. Okay, now that we know why it's important, let's move on to scenario number two. Okay, here's an important one that I usually tell my mentees. This is about how to get a letter writer, and this is also another way you can find a mentor as well. So, say you have a month rotation in pediatrics, and one of your preceptors or attendings is going to be with you during the entire month. So what we're going to do is we're going to identify a potential person of interest, as we'll call them. And what you do is you do what you can to make a really good first impression. You go in, you introduce yourself on the first day. After a couple of days, well, on the first day, maybe you present a patient, you do a good workup, you follow up on a patient, and you do what you can to make sure the attending notices. And then you're consistent with that for the first couple of days, so that way you have a good first impression and you show that it's something that you're consistent with. So now that you've made a good first impression on your person of interest, what you do is you ask for a feedback session. You say, "Hey, Dr. Giwa, I'm really interested in pediatrics and to become a great pediatrician, I want to do what I can to improve my skills. Would it be okay if you gave me some feedback on how I've been doing?" And you don't ask for the feedback at that point. Doing that kind of puts a person on the spot. They're not prepared. And sometimes people don't feel comfortable giving feedback. Or if you do it at that time, it won't be very good feedback. So you say, hey, in 2 weeks, when you've had a better opportunity to see what I can do, I would really appreciate some feedback. The next 2 weeks, you make sure you shine. And then now it's 2 weeks have passed. You go in the morning and said like, hey, um, remember 2 weeks ago when I asked you about that feedback session? Would it be okay if we had it sometime today or later on in the week, if you're free? So that way you again don't put them on the spot and you put the ball in their court. You're like, yeah, sure, come to my office later on this afternoon. You present in the morning, make sure you shine. You go to the feedback session, they give you feedback. Hopefully, most of it is good feedback. Maybe they give you some constructive criticism, feedback. You make sure you take it well. Thank them for the feedback. If you need to defend something you did, like, oh, you know what? That is a good point. I did do that. Oh, you say I speak too low during rounds. Okay, yeah, that's a very good point, and I can see what you mean. I was speaking low because I didn't want to wake up the parents, but I do understand it's important for the team to hear everything that I say, and I don't want them to think I'm not confident. So I will work on making sure I speak more loudly and clearly for everybody. So right there, once you're done with the feedback session, you actually have a sneak preview of what your letter of recommendation is going to look like. Do they think mostly highly of you? If the answer is yes, hey, you've identified your letter writer. If most of it is negative, maybe not the best person to ask. In which case, maybe you could ask one or two other attendings too in the beginning if you're not so sure. It's one inpatient, one outpatient, so they don't know. And then if you think the person thinks you're good, what you do is you say, um, I'm really glad, thank you for taking the time for doing this feedback session with me. I'm really interested in pediatrics. As a matter of fact, I'm planning on applying in a couple of months. And I really appreciate all the information that you've given me in leadership and guidance and such, do a little flattery kind of thing. And I was wondering if you would feel comfortable writing me a letter of recommendation. Now, this part's important that you phrase it the right way because If you're like, please write me a letter of recommendation, they may do it, but begrudgingly. If they do it begrudgingly, there's a chance they can write you a bad letter of recommendation. And you don't want that. And as Priscilla said, you want to make sure that they know you well. Maybe they say, you know what, I don't think I've seen you do enough. Maybe you asked the wrong attending and they only seen you present 2 or 3 times and they don't feel comfortable. Either way, you want to make sure this person thinks well of you, um, knows you well, and is willing to write you a letter of recommendation. Because if they write you a bad one, you won't know. But usually, if you did things properly in the first part, they'd be like, "Oh, I'd be happy to write you a letter of recommendation." Then it's that time you're like, "Ooh, I'd be honored. That'd be great." Now, here's the next pro tip. Now that they've agreed to write you the letter of recommendation, you don't stop there. You say, "I really appreciate you doing that." To follow up with this, how about let's have a meeting so you can get to know me better? Maybe they've only seen you present a few times, but they like you and they want to write you a letter of recommendation. So for them to know you better, you set up a meeting with them and like, hey, this is a meeting just so you can get to know me better and so that you can write me the best letter of recommendation possible. So before the meeting, you send them your personal statement. If you did your personal statement well, they'll have a good idea of your background and your passions. You can even send them your ERAS application if you'd like. And then during the meeting, you talk about why you want to go into medicine, why you want to go into this specialty. And then they can ask you questions so that they can write you the best letter of recommendation. And then you can also talk to them about potential things they can highlight about you that you want in your letter of recommendation. So that's scenario 2. And then also, if you guys have any questions, feel free to ask me along the way or put them in the chat and we can answer them later um, as the Madam Host will allow. Okay, scenario 3. So now I want to be sure to get to the tough stuff. This is the cold meeting. I call it the cold meeting because it's reminiscent of a cold call. This is when you bump into a person of interest at any place. It could be at a conference, and maybe they're not a representative in the exhibition hall. Maybe you're just walking, maybe you're just having lunch with somebody, maybe just bump into them on the street. This is the most difficult because in this one, you have a shorter opportunity to be impactful compared to somebody who's stuck at a booth or someone who you have the next month with. So what you do for this one is you have a shorter elevator pitch and um, here I have some 2 quotes from some really good people about how this is related. Elevator pitch should be like a woman's skirt, long enough to cover the subject and short enough to create interest. So with that, you need to titrate it as tolerated. If you know you only have 5 minutes to connect with this person, then do your elevator pitch really quickly. Just give them your name, your background, and then the next thing you do is you search for a connection point. Roosevelt said, people don't care how much you know until they know how much you care. So, with that, find something if you can in their background, a Google search if you see them from a distance, or if you know who they are before the interview, things like that. Or you listen attentively during the chat and you make that connection um, to spark their interest. So here I kind of outlined how that is. And that's something that both student 2 and student 3 did in the beginning, both with the necklace as well as the name. And then, as we said before, you want to seal the deal with the making sure you exchange information, and then you follow up with an email. So that way you have a point of reference if you need them to talk to them in the future. Um, And then, as was said, talking to them in the future, you don't necessarily need to be besties and don't always only go to them when you need something, but especially if it's social media, hey, comment on their post or something, or ask them one question every once in a while, as opposed to maybe can dauntingly ask, hey, can we have a 3-hour session to talk about how to get me from this point to that point? pro tips. So I'm going to go through these next parts more quickly just because we're running low on time. And what I'll say with this is you always want to do what you can to improve yourself from a developmental standpoint. And that doesn't only mean by medicine. So, as Priscilla mentioned, she's really into music. So by expanding the realm of your expertise in different places, you'll be able to connect with people a lot easier because maybe you have some knowledge of music or current events or finance or such. So I always try to actively do that. So I'm actually reading an audio book, Law School for Everyone. And this is one of the things they talk about in regards to being persuasive, because your advocate is who's going to be advocating for you, and you want to persuade them that you're a great person. And this also ties into what should be in your elevator pitch. First, ethos. Peel with your authority, credibility. You could do this by just the way that you are, your grammar, your tone, your body language, and your elevator pitch background. Make it related to what you're talking about. So, that would include, where you did your education, what are your qualifications? So you can get them to think that you're credible. Next, pathos, appeal to their emotion. Um, we already kind of talked about that. What you can do is connect with them, find common interest, or at least show that you're listening. Even if you don't know all the stuff that they know, ask good questions. Show that you're listening by using their words. So when I'm on an interview, sometimes when I answer questions, I may say, "Oh, as was stated earlier," or "as you mentioned," or how I referenced Priscilla a couple of times before. Priscilla can tell I was paying attention. So you can make them feel some kind of way. And that's good about you. Um, Logos, appeal with logic, use actual facts and logical reasoning to support your argument. So when they're talking to you and they're telling you things, don't just say, yeah, yeah, that's great. Try to opine with your perspective or ask thoughtful questions, or if you know something about it, feel free to add to it. The other thing to remember is the primacy effect. People remember what you said in the beginning and at the end the most. So make sure that you make those parts the best. And when you end, do a little summary and go on so that they remember why they should network with you and what you need. Since I can't go over all the great tips, here are two good resources. As again, I said, constant personal development is important. So here are two books. If you read any book on personal development or interactions, they will reference this book. It's been around for over 100 years. And here's something that has 92 little tricks for networking. That's great. Both with making small talk, whether going to interviews. It's a great book to listen to, or read. I had them as an audiobook, and they're very easy reads. And just a little bit more on this book. This one actually kind of outlines all the different parts that you can learn. It's a very easy read, as I mentioned, and you can see these different sections. And just an example, this one shows you how you can smile, because people say, "Hey, it's about your body language. Make sure you smile. Make sure you sit up straight." What does that mean when you smile? Does that mean you walk around like this the whole time? Or does that mean you have it on this entire time? So she goes into detail, um, exactly how you should do it and good tricks to do them well. All these different techniques. So here are some of them. And here's just some good examples. And one thing I'll tell you about these, here's are good ways to go into a place if you really want to network. And I'll just give you a walkthrough example of this. We mentioned good posture, the way that your head looks, confident smile, direct gaze. So when you walk into a room, pretend there is a string hanging in front of you. And you go and you bite it, and then pretend the string lifts you up. When you do like this and you stretch like this, your muscles are stretching the proper composure. So now you're like this. So this shows that you are standing with assurance, you're moving with confidence, and you smile softly with pride. You go over and you talk to somebody. This is called the big baby pivot. What you do is you fully turn towards the person that you're interacting with to show that you're giving them undivided attention as if you were attending to a baby. And it makes that person feel special, like, oh, this person's really paying attention to me. The next one is the hello, old friend. Going back to this Roosevelt quote. So, what you do with this one is you pretend that you're meeting an old friend. When you walk into a place, you should have a little bit of a soft smile, but then when you meet the person you want to interact with, you look at them, you pause, and then you come up with a smile like it's somebody you haven't seen for a while. That makes you look more genuine, that you particularly are happy to see them, and it makes them feel more special. So, hey, tequila and sticky eyes. Maintain eye contact with that person. And if you need to look away, just pretend you have sticky eyes and just like, okay, but you got to get back to it. Okay. And the last thing I'll talk about is business cards. Um, How many of you have business cards? One in the chat if you do, two in the chat if you don't. So nowadays, there are a couple of ways you can do business cards. Some people have paper gift business cards. Some people are more green and they use a QR code. They may have just something on their phone that they show, and then you just scan it, and something like this will pop up, and you can exchange contact that way. It's always good to be prepared. So if you know you're going to network with somebody, don't say, "Oh, I got it," and fumble through your wallet or look through your purse. Have it easily accessible and maybe a side pocket, which is why I sometimes like to wear vests. So you could just pull it out that way. And you can have your own thing over here. This is my business card and it has a QR code. So you can do it that way. Next, what are the ways you should if you want to do social media? LinkedIn, maybe Instagram. More people have these nowadays, and you want to make sure you clean up your social media. So control the narrative. If you're interacting with somebody, and especially if they're going to advocate for you, they're going to do their research on you. So make sure the stuff that you have is clean. If you're doing some crazy things or even a regular kind of things that could be perceived as questionable, have a separate account for that that's not directly connected to your name. Because I'll tell you, I've definitely been on interviews and people have said, like, oh, yeah, I Googled you and I saw that presentation you did 10 years ago. And I'm like, I mean, it was a good presentation, but it just goes to show you that that wasn't on my application, but they will find it. So do what you can to control your narrative. Um, and here's an example. So with my nonprofit, you're always ready. I have my business card in case I'm talking to somebody and they maybe need services or they're interested in donating. I have my card ready. I also, if I don't have my card, I can just pull this QR code up on my phone, give them my elevator pitch about how we go and we do mentoring, ERAS application reviews, personal statement mock interviews, and then quick they're taken to a page over here. You can exchange your contact and then all the stuff over here. So if they want to sign up to be mentored, just click that link. They can email me, call me, beat me. If you want to reach me, if you want to page me, it's okay. So you have it all there. So you're not like, how do you spell a dable law? So that's why it's good to be prepared no matter where you are, whether you go into a conference or not. That's why the QR code is a good idea because you can always just have it on your phone. And that's it for me. And if any of you are interested in my services, I do personally mentor up to a dozen or so medical students, pre-medical students, residents each year. I think some of my mentees are on this call right now because they networked and I told them about this great opportunity. So you can just scan this QR code or go to this website and just hit the mentorship application and there's enough space, I'll be able to help you out. And with that, I'll give it back to wonderful host Priscilla.
Thank you so much, Dr. Giwa. I learned so much, even personally, that I'm going to use for starting residency as well. And I hope everybody else learned things as well. What I want to do right now, really quickly, is we have Dr. David Yao on, and he's going to be one of the doctors as well as Dr. Giwa for the small groups. I know that we're a little bit short on time, but that's okay. What I'm going to do is put in the chat as well um, the link for the um, template that we can use to write some short elevator pitches. And so we had a lot of great instruction from Dr. Giwa. And so the hope is that in addition to what you just learned, you're able to craft like a really great small elevator pitch.